Thank you for inviting me to give this talk to this IRCAD fantastic meeting. My name is Joel Dunning and I'm going to talk to you about instrumentation, imaging, but also a lot of amazing things coming up. It's been a pretty rubbish year, what with coronavirus and many other things, but I just want you to take a step back. You might think it's awful in thoracics, you might think it's awful in the world, but remember this, the world is getting better. Poverty is going down, hunger is falling worldwide. Child labour on the decline, life expectancy is better than it's ever been, child mortality is down, more people go to school, literary rates are going up, don't believe the hype, things are getting better. Polio's nearly got rid of, from 500,000 a year to only 46 cases last year. Even this, horrible disgusting guinea worms being eradicated, we're getting taller, we're getting more democratic, we're more peaceful, we're safer, we're richer, and we have more free time. So things aren't that bad in the world. What about thoracic surgery? Well, you might think that we've had a year of no innovation. You'd be completely wrong. We have new things coming at us left, right and centre. So we're the proud owners of 2 new robots. We've got our Cadier, Maryland and tip-up graspers with our brand new XI. We're just trying out some different staplers. This is our standard 12mm Covidian stapler. This is the Sureform 45, the new second generation of stapler on the robot. More versatile, more mobile, but that's quite a small branch there in the left upper lobe here. So actually I thought that was a bit big. So here is the brand new 8mm Covidian stapler. Isn't that beautiful? 4 rows instead of 6, really hemostatic, 50 degrees articulation, a massive step forward for stapling this year. So I certainly encourage you to get one of these, get your rep to get one of these staplers. So that's what's new in staplers. We've actually already sort of become routine, our hook ligashore. Is it a ligashore? But you can see the hook just loaded up on the back of it there. You one click and it's straight into a hook. Hook ligashores has also got Surgiwand, which is a sucker and a hook. So there's all these multiple instruments in our armory. Our NUS performance has been transformed by cryoanalgesia, so we now routinely do this for NUS and other very painful procedures, and this is a great new innovation. We, on our robot now, take patients to a CT scanner and inject in the CT scanner some ICG, and we can mark the nodule, and then as well as doing segmentectomy we can label it. But these are the new things on the block. Wristed instruments. If you don't have a robot, get yourself a wristed instrument. There's a whole new battery of these, and they're so easy to use. So these are me using 2 of these instruments. This is a left upper lobectomy. I'll show you more of this later in the sessions. And you've got full, beautiful wristed instrumentation. They're bipolar, there's a hook, there's a spatula, there's scissors, and this is a Maryland and Johan. I think these are absolutely great. You need to practice a bit with them, but once you're practiced, I think you can emulate a huge amount of what you can do on a robot using these wristed instruments. The thing I really like about the wristed instruments is this, the ability to go in a right-handed, in a curve, rounder vessel, and you can get round vessels. No longer do you need to choose what angle an instrument's going to be to get round something. You can get round it both sides, any way you like. Nice blunt instrument, and really is a great addition to our armory, these Artisential wristed instruments. The great thing about them is that you can be by the table, so you don't have to be by a console. That's safer. You've got your tactile feedback back with you. You can do your own staple firings because you're at the table, and you can also chop them in and out, and you can take out these instruments and bring a sucker back in. You can bring the bag in yourself. You can bring any other instruments in. It's much more versatile for matching with other instruments. So if you haven't already, I really encourage you to have a go with wristed instrumentation, and in some of the talks subsequently I'm going to show you a few of these as well. What else is on the market? Well, brand new is the Cambridge Medical Robot. This is us doing a cadaveric study. This is what they look like, completely different to the intuitive offering. These are 5mm instruments, and as you can see, there's a base unit for each instrument. You can have, in fact, up to 6 if you really like, but we're experimenting with about 4. And they're all 5 mils. They go through normal allied medical ports. And this is one thing I really like. I'm standing up. I've got a nice open platform console. I don't have any foot pedals. They're like Game Boy controllers split in half. A lot more instruments on your fingertips. And it's a really good new controller. And I'm going to probably double glove so I can come back to the table straight away. I might even come to the table to do some firings. But I really like the new Versius offering. The first thoracic case might be done in Germany in the next 2 to 4 weeks. Been over 1,000 cases in the abdomen, and we wait to see this year probably what we're going to be able to do in thoracics with this brand new robot. Now this is brand new. So I said the first case is going to be in Germany. Well, I've been doing quite a lot of development work for Versius, but I can't go to Germany to help with this first case. So we're doing remote telementoring. So this is me on my laptop at home with my coffee. I've got 4 camera views. I've got the internal view. I've got the Versius view on the outside. I've got the surgeon bottom left there with his hands, and I've got a 4th camera. And that's me at the very bottom there videoing it because he's doing such a brilliant job. But we're now doing routine telementoring. What an amazing advance this is to our future. Every company is looking into this. This is going to be huge. This is going to be our future. No longer am I going to have to take a day off, take a flight somewhere, come to URCAD for 3 days just for one 15-minute talk. I can zip on my laptop. I can mentor perfectly, just like I was there. And this is great. Every single company has an offering. The intuitive offering has a roving iPad, so you can ask somebody to move right up to the ports, and this is coming. This is real. This is actually going to be a feature of our lives from now on. This is great. We're now looking into this. You may have heard of rods and cones. This is Versius by a subsidiary of Medtronic. You wear this, and that's a laptop that is showing the camera view on my head, but I've basically got a little mini laptop in there. You don't see it very well in there, but I can see exactly what's on your laptop screen. I've got one-to-one sound with you on your laptop and me, and I think this is going to be amazing for open cases, for medical student immersion days, for maybe industry supporting you with equipment. Put this on your head, patch into their laptop at home. They see everything you see, and this will be great. This is really going to transform the way we bring people to support us in our training efforts in the future. Just a few new things that we're also doing. There's a new UK study called Mastery. This is a 12-centre study going to recruit 500 patients. What are we doing? Well, every single arm movement on my robotic lobectomy is getting recorded by this gadget bottom left. We did the very first one in the whole trial, and we're going to collect 500 cases, and we're collecting clinical outcomes, all the obvious in-hospital outcomes, 30 days and 90-day patient quality of life. And what are we going to do with it? Well, the sky's the limit. We could hopefully metric what makes a competent operation. So my assistant here, who's Ben, my ST5 registrar, who's done 11 robotic cases, we can actually say what are the metrics that mean he is as good as I am. He's actually as good as I am already, but that's an aside. But maybe you can start getting scoring and metrics, and then you can work out when surgeons are competent and safe. You can work out when your registrar is ready to progress to the next level. You can maybe do so much if you collect all our hand controls. This is happening now. We're going to get metrics, and 5 years' time, instead of doing 20 cases before you're competent, you will get up to the agreed acceptable level for quality of control of the robot. In terms of what is out there in imaging and capture, because that was part of the title of my study, the world is exploding with this. This is going to be our future. So there are several offerings. There's CSATS by Johnson & Johnson. There is touch surgery and digital surgery by Medtronic, and there is ORPHEUS by Intuitive. I'm just going to show you some mind-blowing slides about this, mainly from the CSATs. But what these are doing is these are doing what Mastery Trial's doing. They're recording your videos and sending them up to the cloud. They're segmenting and chopping them up. They're looking at your hand moving. They're giving you metrics and allowing you to share your experiences with your colleagues. So let's take a look at some of these incredible offerings. This is CSATS. You can look at it right now on your phones, csats.com. So it records all your videos, mainly robotics. It's got 60% robotic videos. They've got 30,000 operations already. But this is the amazing thing it does. It gives you all those metrics. It'll tell you your operative time. It'll segment it up. So the wedge part was 12 minutes. The lymph node harvest, 12 minutes. Isolate the pulmonary artery, how long that took. Idle time, how long you were doing nothing. How long were you suturing? And it's going to give you a technical skills summary. So it's going to give you metrics. Where do these metrics come from? How does it know about your bimanual dexterity, your depth perception, and these other metrics? The answer is crowdsourcing. They're going out to 15-year-old geeks out there, non-experts, not surgeons. They're showing them how to metric depth perception, robotic control, force sensitivity. They get about 5 people to do it. They get rid of the lowest and the highest score, and they give you a metric. All those guys are scoring your videos, and you get a score. Not only do you get a score, but you then get to find out how good you are compared to those 30,000 other operations. Now, the future is clear. We're going to get rid of those crowdsourced patients. It's all going to be AI, isn't it, in the future? But at the moment, we need to score it. The other really cool thing is they're also going to be able to send all your videos to experts, so you can get expert comments and interact with them, just like a Facebook for surgeons. You're obviously going to be able to check all your times, but here's a really cool thing. If you have all your comments about your video, they're actually going to use intelligent learning to see the comments. What was positive about your comments? What have you got negative about your comments? And it can feed that back to you. Isn't that fantastic? They're also got a huge library of all the videos, so you can go and basically do an academy. Go and find all the people that got 24 out of 25 on their metrics in a right upper lobectomy. If you're struggling in a right lower lobe fissure last operation, go and see the 24 out of 25 case. It won't be the surgeons doing talks at conferences. It'll be some little quiet guy just getting on with his job in Wisconsin, probably. This is going to be transformational. On a few little other gadgets and gizmos we are testing out. This is a nociceptive pain control monitor. You may have heard of a BIS probe in monitoring how awake someone is. This is the pain version. So we're using Juan Carlos Pereira's multimodal mix of local anaesthetic. It's got bupivacaine and bicarbonate and clonidine and dexmetomidine and magnesium and a few other things as well to make things work really nicely. But this NOS probe, this null monitoring, is telling us whether it's working. Today I only did 7 intercostal spaces because the lung was stuck at the top. When I was burning at the top, the null went up, and then when I blocked after it came off the chest wall, the null went back down again. It really works. Finally, we have a monitor that tells you whether you're causing pain in an operation. I think that is amazing. We have other things that I don't have time to really go into. We have an acupuncturist on our service, and amazingly, he's doing 30% of our staff as well. He's doing really good things. We've got an advanced nurse practitioners on our ward. They spend 3 days on the ward, and on the 4th day, they go and see the patient at home that was discharged the day before. So day 1, you get a visit from our nurse that saw you yesterday on the ward, and this has been submitted and given a national award for innovation because it's sending people home in the times of COVID far faster. We have an app now to support our patients. They're sent all this. They've got videos welcoming them to our service. They've got all sorts of information. They've got forms to fill in. They've got questionnaires. They've got EQ5D scores, anaesthesia explained, all sorts of things. But the really cool thing is post-operatively, they've got pain and well-being questionnaires. So they fill in every single day whether they're in pain and what their medications are doing. EQ5D for 90 days, and then for 5 years a cancer questionnaire for cancer follow-up. And I've got thoracic e-learning. We've got a 46 module e-learning course, and I don't have time to go into this because our time is up. So thank you very much. My name's Joel Dunning.